with back problems have tried everything from physical therapy to acupuncture, like myself, and nothing seems to work. We'll look no further because Dr. Barry Schleider is here to introduce a non-surgical treatment called decompression therapy to get you back on track.
Yeah, back on track and off your back. So the treatment, this is everybody. Everybody I know has lower back problems, and other people have other back problems. So this is a whole new technology, only a few years old. And I want you to know I've tried everything, because I smashed my back up when I was about 25 years old, like an idiot. I was racing snowmobiles in Minnesota at the time, and all that pounding all winter. And I had trouble. I even have numbness in toes from the sciatic nerve going. So anyway, enough about me. Let's talk. You talk about me for a while.
Talk about me? What do you think of me?
Yeah.
Tell us about the treatment. Tell us about this treatment.
Yeah, this is...
When you say everybody, it's literally 85% of the population. So by age 50,
it's
statistically 85% of the population by age 55 has degenerative disc disease, or what's called dry disc disease.
What is that?
Well, what that means is if you look at a disc is made up of two parts. There's an outer part of the disc, which is cartilage like our ears or our nose, and then there's a center part of the disc, which is actually liquid. And over time, injury or a combination thereof from either gravity or injuries or falls, that disc starts to dry. It loses its hydration. In non-surgical spinal decompression therapy, this is a table that was developed by a neurologist, and all we're able to do literally is to isolate one individual disc, tell that computer that we need to reverse that process, if you would, take and create a vacuum effect on that individual disc. We're about 70% waters, nutrients, and oxygens. It brings back the fluids back inside the disc, creates a vacuum effect on protrusions and herniations. As we say, we treat the cause, not just the symptoms. That's why we're able to get people well, not just better.
Always the problem for years, treating the symptom, and never getting to the underlying cause. So that's what you do. So that's the big difference. Because I've hung upside down, I've had acupuncture, I've done, and you know what, it all worked a little bit. Sure. But this is revolutionary.
Yeah, it's funny when you say hang upside down, because everybody asks me about inversion units. Inversion units are very, very good. The difference between general traction and decompression therapy is the downward pressure on a disc in an upright position is 100 millimeters worth of positive mercury pressure. When we take you into decompression, it goes to 0 and then to 160 millimeters worth of negative mercury pressure. That's where the rehydration occurs. If you're doing traction or inversion, it goes from that 100 to about 40, never reaching to 0 or beyond, which is what's required for the decompression.
So the results are what?
Temporary or
no,
temporary?
Results are staggering to begin with.
Really?
This is my 28th year in practice. I am the founder and director of the Non-Surgical Spine Care Center. Currently we have one here in San Diego, we have one in Orange County, one in Pleasanton, one in Stockton. We have one opening up in the state of Washington. And the results are permanent. We're actually able to heal the outer part of the disc. We're able to bring that fluid back inside.
Wow.
I wonder why this isn't happening more often. You know, why aren't more people being treated with it?
It actually is, but there's there's not a great deal of investigation that has been done by the insurance companies. The insurance companies are hesitant to go ahead and do much of anything.
Oh, sure, always.
Yeah.
Right.
Now listen, you say get your second opinion first.
Correct.
What do that mean?
What we're saying is the majority of our patients have been through the usual gamut. They've been through the epidural steroid injections. They're on heavy narcotic pain medications and muscle relaxants. They've been told they need the surgery and maybe don't want to have it. We're able to actually keep people from having those surgeries. So we're saying rather than go through all that gamut of trauma and pain and illness that most people go through, see us first and let's at least show you what we can do without the medication, without the injections, without the surgery.
Wow.
I would think that it would be a little scary for somebody to come in that has never heard of that. Everybody they know has had to have the surgery, you know. So do you provide kind of like an educational seminar, treatment, school, class kind of gig?
What we do, which is more unusual than any other practice that you ever see, is we spend about a good hour with each patient in doing a consultation. We first listen to the patient as to what they've been through, what they've suffered from. Then we go ahead and we tell them what it is exactly that we do in non-surgical spinal decompression. We have large screen TVs with video presentations and graphics that show exactly how the disc works. We take them on a tour of our facility. We show them the tables, so on and so forth. So we take away all their apprehensions. And most of the people that we see have been through so much. And they literally, there's a condition called failed back surgery syndrome. And if you ever look that up on like a Google search, they'll be pushing 2 million articles on describing what failed back surgery syndrome is. So these people want to get away from it.
Non-Surgical Spine Care Center, all right? Dr. Barry Schleider 888-550, you see it there, DISC.
Or you can go to nospinesurgery.com. Music to a lot of people's ears, Dr. Schleider.
Right.
Thank you so much for coming in.
Thank you for having me.
And don't forget, you can